Well, it gets me going. It makes my mouth start. It makes my face go like this. And then I make it. Ooh,
Yeah, but they're high pitched.
And it just keeps going. It just keeps going.
For like a minute, 5 minutes?
Oh, sometimes 5-10 minutes. I just can't stop it. It's like a attack. It just hits me real hard, and then it just keeps going and going. And finally, I have to give up and take some Ativan, and that usually within a half hour that will stop it.
Okay. How long have you been having those attacks? The muscle twitching?
Well, I've had that for over a year now. No, well, how long do you think that's been?
You've been dealing with this for over 2 years.
Yeah, but the muscle twitching.
Well, it started in your eyes. You remember those?
Started in my eyes, but then it got going about a year and a half ago. It started making the noise.
What do you feel with the eyes? Do you feel like your eyes start twitching, or what are the symptoms that you feel with the eyes?
It's sort of a blinking, where I close my eyes like this. And, but the eyes haven't really been bothering me since I have Botox shots. Every couple of months, I go down to the USC Medical Center where, I guess it is every 3 months, I get Botox.
Yeah,
They put in about 16 shots in my face.
Okay.
All around the eyes, all around both eyes, down along through here, and all the way up in here.
January 20th.
Okay.
Matter of fact, I'm due another.
Okay. So, since they've been doing the Botox, the eyes have been good, but the jaw hasn't?
No, it hasn't.
Okay.
It's amazing how I had attacks today. I was using this in the mouth. You want to take a picture of this?
Sure.
Let me put it in my mouth. Show you how it works in the mouth.
Mm-hmm.
His last set of Botox shots was January 20th.
I'm gonna look. And and this will stop the facial tic right away, just instantly. I've tried just at night when I'm having trouble, which I don't have this. I don't want to do this at night. I've tried just opening my mouth so far, and it's actually stopped the attack. But this works really good.
Tell me about your TMJ.
Well, I've used the type you buy at Sport Chalet and Night Guard, and I've tried those. I have one at home, and I put it in there, but it's too oversized, so it doesn't really work that well.
He went to the dentist.
Okay.
And the dentist suggested, I think he suggested the over-the-counter one first, right?
Right.
And so he went and bought one and used it for a while, and it solved the problem that he was having at the moment.
What was the problem?
Well, I think it was pain and clicking, wasn't it? We were having a lot of pain from it.
Tell me about your headaches and dizziness.
Lately, I've been really dizzy. When I bend over, be stupid, standing, and all of a sudden I get real dizzy now. I feel I'm going to pass out. And headaches. I've been getting headaches I haven't had a headache for a while, and then just recently I've been having headaches every morning. I'll take a Tylenol, one Tylenol, 500 milligram Tylenol, and that usually stops it.
Okay.
But the headaches are usually right in here.
Right in the forehead there?
Right.
Do you feel any pressure in the back of your head, any
No.
tightness? Okay, just right there in the forehead. And how long have you been having the dizziness?
It's been several months already.
Okay.
Yes. I felt like just the other day it hit me again.
I remember you commented to me.
said, whoa, am I dizzy? And it's hard to get my thoughts.
The medication he's on has just turned him into a zombie, and he's having a lot of trouble gathering his thoughts and putting them in words.
I take Cogentin and Haldol practically every day because I have the shakes now, and I didn't have it before. The facial tic was so bad that I wanted to do harm to myself. And they put me in a mental ward, a psych ward, sort of like one. It was still a lockup. And I was in there for about 19 days, which I didn't like.
Okay.
That was it. That was the real thing.
One of them.
I should comb my hair and make it look prettier.
Well, the tremors are caused by your medication. Your legs and hands and the stiffness.
Yeah, I'm changing the medications. I'm gonna get off Haldol.
Yeah, but the one you're going to go on is the same type, so it'll probably still have the same side effects.
This facial tic is really something. It really gets going.
You're having a hard time breathing?
Yeah, right now.
It's not as bad as it often is. What he does is he'll take in a breath and hold it, and all of a sudden, explode it out. And does that repeatedly. I keep waiting for him to drop dead in the middle of it from lack of oxygen or something.
The mouth opens up, and it's the same thing. It's just the same thing I always do.
And he's humming constantly now.
Okay.
I don't know if that's going to make any difference.
Bite, tap, tap, tap. Bite and hold. Open. Open wide. Bite down. Tap, tap, tap. Good. Open. There we go.
So see now it got started again.
Mm-hmm.
It's like a short circuit in my brain.
Okay. I'm gonna go ahead and put this mouthpiece in.
It got going bad again.
When we were out?
Yeah, but she got it.
Okay, good. Let's go ahead and put this in.
At least he doesn't bark and curse.
Bite. Tap, tap, tap. Just sit there for a minute.
What happened was that he I think I mentioned it started in his eyes, and the ophthalmologist thought it was dry eyes, and it just progressed and got worse. It got to be so bad, and we had no diagnosis, that he wanted to kill himself. So into the hospital he went, and that's where they gave him, you know, where they tested him and did all kinds of stuff. And that's where they came up with the Tourette's.
How are you feeling?
Fine, more relaxed.
Okay, it's been 3 weeks since we last saw you and I did the adjustment for you. Right now you have it out. Give me an update of what you felt over the last 3 weeks.
Real good. Been holding not too many facial tics, unless I take the mouthpiece out, and then I have the facial tics. But otherwise, it will hold it by having it in my mouth, and it will control the facial tics really well, except for now.
Go ahead and put it in. How much would you say the facial tics have improved?
Right now?
Overall over the last 3 weeks.
80–90%.
Okay. All right. Good. Anything else?
No.
All right. That looks good. No tics. How does that feel?
Good.